Delayed ejaculation represents one of the most misunderstood and underdiagnosed sexual dysfunctions affecting men worldwide. Unlike premature ejaculation, which receives considerable attention in both medical literature and popular discourse, delayed ejaculation remains shrouded in silence and misconception. This condition, medically defined as the persistent or recurrent delay in or absence of orgasm following a normal sexual excitement phase during sexual activity, affects approximately 3 to 4% of men globally, yet many suffer in silence due to stigma and lack of awareness. The complexity of delayed ejaculation extends far beyond its clinical definition. Men experiencing this condition often find themselves caught in a web of psychological distress, relationship complications, and declining sexual confidence. The condition manifests differently across individuals, with some men experiencing complete inability to reach orgasm during partnered sexual activity while maintaining normal ejaculatory function during masturbation, while others struggle with prolonged time to climax that causes distress or frustration for both partners involved. Understanding the underlying mechanisms of delayed ejaculation requires examining both physiological and psychological factors. From a physiological perspective, the condition can stem from various medical causes, including neurological disorders, hormonal imbalances, certain medications, particularly selective serotonin reuptake inhibitors, diabetes, multiple sclerosis, and spinal cord injuries. These physical factors can disrupt the complex neurological pathways responsible for triggering the ejaculatory reflex, creating barriers to normal sexual response. Psychological factors play an equally significant role in delayed ejaculation cases. Performance anxiety, relationship conflicts, past traumatic experiences, religious or cultural inhibitions about sexuality, and psychological conditioning can all contribute to the development and maintenance of this condition. Men who have developed specific masturbatory techniques or rely heavily on particular stimuli may find themselves unable to achieve orgasm through different types of stimulation, creating a cycle of dependency that impacts partnered sexual experiences. The diagnostic process for delayed ejaculation involves comprehensive evaluation by healthcare professionals who specialize in sexual medicine. Medical history, physical examination, and detailed discussion of sexual practices and experiences help identify potential causes and appropriate treatment approaches. Healthcare providers must distinguish between lifelong delayed ejaculation, which has been present since the beginning of sexual activity, and acquired delayed ejaculation, which develops after a period of normal sexual functioning. Treatment approaches for delayed ejaculation vary significantly depending on the underlying causes and individual circumstances. When medications are identified as contributing factors, healthcare providers may consider adjusting dosages, switching to alternative medications, or implementing drug holidays when medically appropriate. For cases with psychological components, psychotherapy and sex therapy can provide valuable tools for addressing underlying issues and developing healthy sexual responses. Behavioral interventions form a cornerstone of delayed ejaculation treatment. These approaches focus on gradually modifying sexual behaviors and responses through structured exercises and techniques. Sensate focus exercises, developed by Masters and Johnson, help couples rebuild intimacy and reduce performance pressure while exploring different types of stimulation. Progressive stimulation techniques allow men to gradually adapt to different forms of sexual stimulation, breaking patterns of dependency on specific stimuli. The impact of delayed ejaculation extends beyond the individual experiencing the condition, significantly affecting romantic relationships and partner dynamics. Partners may interpret delayed ejaculation as lack of attraction, inadequate sexual performance, or relationship problems, leading to decreased sexual satisfaction and increased relationship tension. Open communication between partners becomes crucial for addressing these concerns and working together toward resolution. Couples therapy can provide valuable support for navigating the relationship challenges associated with delayed ejaculation. Professional therapists help couples develop better communication skills, address misconceptions about sexual performance, and create supportive environments for exploring different approaches to intimacy. Understanding that delayed ejaculation is a medical condition rather than a reflection of attraction or relationship quality helps partners maintain emotional connection throughout the treatment process. Alternative and complementary approaches to treating delayed ejaculation include mindfulness techniques, acupuncture, and herbal remedies, though scientific evidence supporting these interventions remains limited. Mindfulness-based interventions help men develop greater awareness of physical sensations and reduce anxiety that may contribute to sexual dysfunction. These approaches can complement traditional medical treatments by addressing psychological components of the condition. The prognosis for delayed ejaculation varies considerably depending on underlying causes and individual response to treatment. Men with medication-induced delayed ejaculation often experience improvement when drug regimens are modified, while those with psychological components may require longer treatment periods but can achieve significant improvement with appropriate intervention. Lifelong delayed ejaculation may be more challenging to treat, but can still respond well to comprehensive treatment approaches. Prevention strategies for delayed ejaculation focus primarily on maintaining overall sexual health and addressing risk factors early. Regular communication with healthcare providers about medication side effects, maintaining healthy relationships with open sexual communication, and addressing psychological concerns promptly can help prevent the development of sexual dysfunction. Education about normal sexual response and realistic expectations about sexual performance helps reduce anxiety that may contribute to delayed ejaculation. Research into delayed ejaculation continues to evolve, with scientists exploring new treatment modalities and better understanding of underlying mechanisms. Neuroimaging studies provide insights into brain activity patterns during sexual response, while pharmaceutical research investigates potential medications specifically targeting delayed ejaculation. These advances offer hope for more effective treatments in the future. The societal impact of delayed ejaculation extends beyond individual cases, highlighting broader issues about sexual health education and healthcare access. Many men delay seeking treatment due to embarrassment or lack of awareness about available resources, emphasizing the need for better public health initiatives addressing sexual dysfunction. Healthcare provider education about delayed ejaculation ensures that men receive appropriate evaluation and treatment when they do seek help. Support groups and online communities provide valuable resources for men experiencing delayed ejaculation and their partners. These platforms offer opportunities to share experiences, learn about treatment options, and connect with others facing similar challenges. Peer support can reduce isolation and provide practical advice for managing the condition while maintaining healthy relationships. In conclusion, delayed ejaculation represents a complex sexual dysfunction requiring comprehensive understanding and individualized treatment approaches. By addressing both physical and psychological components, improving communication between partners, and utilizing evidence-based treatment strategies, men with delayed ejaculation can achieve significant improvement in sexual function and overall quality of life. Continued research and education will enhance our ability to help those affected by this challenging but treatable condition.